Have you ever popped a headache pill, maybe after a really long day, and just wondered how you actually know it's safe? I mean, you look at this tiny white disc in the palm of your hand, and it looks identical to 1,000 other white pills. How can you be absolutely certain it contains exactly what the label promises? And more importantly, no weird stuff that could harm you? Well, welcome to this explainer. Today, we're decoding the fascinating, invisible world of pharmaceutical analysis. It's basically the rigorous chemical detective work that protects you, literally every single day. Okay, so here's our roadmap for today. We'll kick things off with the science of safe medicines, then unpack the chemical detectives toolkit. After that, we'll see how the industry sets its gold standard, look at what happens when measurements go wrong, and finally hunt down some hidden impurities. Let's just dive right in. Section 1, the science of safe medicines. Let's talk about the role of pharmaceutical analysis. To really understand the stakes here, we need a quick definition. Pharmaceutical analysis is the branch of chemistry dealing with the identification, determination, separation, and quantification of drugs. But honestly, don't think of it just as academic, textbook chemistry. It's the ultimate quality control process. It is this rigorous, uncompromising gateway that absolutely every raw material and finished drug has to pass through to prove, without a doubt, it is exactly what it claims to be. And this is exactly the process that ensures your medicine heals you instead of harms you. The scope is just massive. It guarantees safety, it maintains efficacy, which just means the drug actually works like it's supposed to. It prevents dangerous adulteration, whether that's accidental or intentional, and it ensures strict compliance with global quality standards. Without this, modern medicine would essentially be a guessing game. Moving on to Section 2, the Chemical Detectives Toolkit. Let's look at the actual techniques. So, our analytical toolkit is broadly split into two eras of science. On the left, we've got the classical methods. This is your foundational, old-school chemistry. Volumetric analysis, like acid-base titrations, where we're measuring liquid volumes, and gravimetric analysis, where we literally just weigh the final substance. But over on the right, we have the instrumental methods. This is the really high-tech stuff. We use spectroscopic methods that use light to identify compounds, electrochemical methods measuring electrical potential, and chromatographic methods that physically separate complex mixtures to crack the chemical code. Now, before we can measure anything, we kind of need to speak the language of measurement, right? And in pharmaceutical analysis, that language is concentration. Think of it as the blueprint for knowing exactly how much of our target suspect, the active drug ingredient, is floating around in a solution. There are a few key ways scientists express this. We have simple percentage strength, so weight by volume, or volume by volume. Then we get into the heavy hitters. We've got molarity, which is moles per liter. We have normality, measuring gram equivalents per liter, and molality, which looks at moles per kilogram. Think of these as just different units on a highly precise ruler. It lets scientists communicate exact amounts without any ambiguity whatsoever. All right, Section 3, setting the gold standard. Let's talk about primary and secondary standards. There is actually a super strict hierarchy of purity at play here. To measure a chemical, you need something perfectly pure to compare it against. Enter the primary standard. These are the ultra-pure VIPs of the lab. They are highly stable and completely non-hygroscopic, which is a fancy way of saying they don't absorb moisture from the air and mess up your weight measurements. Oxalic acid is a great example. On the flip side, we have secondary standards, like sodium hydroxide. Now, these aren't perfect enough to be trusted all on their own, so their concentration has to be precisely calibrated against a primary standard first. It's like this unbroken chain of trust. And all of these standards and rules, they're recorded in the supreme law book of drug manufacturing, the Pharmacopoeia. This is an official, comprehensive text with the exact standards for every single drug and pharmaceutical substance. Depending on where you are, you might follow the Indian, British, US, or European pharmacopoeia. This ancient-feeling but constantly updated tome ensures global uniformity. So a pill made in one country follows the exact same strict chemical laws as a pill made in another. Section 4. When measurements go wrong, let's look at deviating from the true value. Look, even the best detectives make mistakes. In pharmaceutical analysis, an error just means a deviation from the true value. And there are four main culprits that ruin a perfectly good analysis. First, personal errors, just simple human mistakes, like reading a dial wrong. Second, instrumental errors. Your equipment is out of whack. Third, method errors. Maybe the chemical reaction itself has unexpected side reactions. And finally, environmental errors. Something as simple as a sudden spike in lab humidity or temperature can throw the whole experiment off. These analytical errors generally fall into three distinct slices of the pie. Systematic errors are predictable. They always happen in one direction, and you can usually fix them if you track down the source. Random errors are, well, exactly what they sound like, completely unpredictable fluctuations. And then there are gross errors, which are honestly just due to negligence or careless mistakes. Our goal is always to recognize these categories so we can shrink that margin of error to pretty much zero.
To actually conquer those errors, we've got to understand the difference between accuracy and precision. People use these words interchangeably all the time, but in chemistry, they are very different things. Let's use the classic dartboard analogy. Accuracy is hitting the bullseye, the true value. Precision is throwing all your darts so they're tightly clustered together, even if they completely miss the center. In a perfect world, our chemical tests are both. We hit the bullseye, and we hit it repeatedly, every single time. So, to guarantee our results are highly reliable, labs rely on strict sequential protocols to minimize errors. Step 1 is proper calibration of everything. Step 2 is taking repeated measurements to weed out those random errors we talked about. Step 3 relies on scientists using the exact correct technique. And Step 4 ties the whole shebang together with rigid standard operating procedures. Seriously, it leaves absolutely no room for guesswork. Section 5. Hunting down hidden impurities. Let's catch those unwanted substances. Impurities are simply unwanted substances hiding in our drugs, and they are sneaky. They can infiltrate our medicines in a bunch of ways. They might hitch a ride in the raw materials themselves. They can be accidentally introduced during the manufacturing process. They might pop up from poor storage conditions, causing the chemicals to decompose. And sometimes, get this, impurities can even leach into the medicine right out of the containers and packaging they sit in. Because of that, we need a final trap, and that trap is called a limit test. A limit test is a semi-quantitative test used to detect and control incredibly small, trace amounts of impurities. These are highly targeted searches for the real bad guys. We run limit tests for chloride, for sulfate, iron, and absolutely crucially, for toxic heavy metals like arsenic and lead. If a batch of medicine fails a limit test, no way, it does not ship out. Period. Which leaves us with this final thought. Think about your medicine cabinet right now. Every single pill, every syrup, every ointment in there has run this incredibly complex gauntlet. I mean, how much invisible chemistry is protecting you every single day? Pharmaceutical analysis is totally the unsung hero of modern healthcare, demanding absolute perfection so you never have to think twice about safety. I hope this explainer opened your eyes to the unbelievable precision happening behind the scenes. Keep questioning, keep learning, and we'll see you in the next one where we'll dive even deeper into specific techniques like acid-base titrations. Take care.